So I'm going to be Colin's already, as you know, talked to you about effective e-cigarettes as effective quitting agents for smokers who are unable to quit with other methods, and put to you that there are good reasons for thinking that e-cigarettes are much less harmful to smoking, of the order of 95%, accepting everything that Nico says, that making these kind of quantitative estimates is terrible, but I think not making them is even worse. So I'm going to discuss, I'm going to firstly put to you that helping smokers reduce harm or quit should really be core business of addiction medicine. Secondly, I'd put that e-cigarettes are quintessential harm reduction for tobacco, and they have substantial net public health benefits. Let's consider the question of whether or not we should be interested in the question of smoking. Remember that this is not just true for Australia, but around the world. There are more deaths in Australia from tobacco than from all other psychoactive drugs combined. Similarly for disease, and similarly for cost to the economy. As Colin's already mentioned, up to 2/3 of smokers will die from a tobacco-related cause. Many of us in this room work with people with severe alcohol and drug problems, and many of those people are going to die from a tobacco-related cause rather than an alcohol and drug-related cause. I remember reading a paper on this early in the 80s, an estimate of just how many alcohol-dependent patients die from lung cancer. Well, of course, the alcohol's not causing the lung cancer, it was the tobacco. So this is another very important reason why we should be taking this more seriously than we have in the past. It's estimated there are going to be 1 billion deaths from cigarettes in the world in the next 100 years. It's unimaginably large figure. Colin's already mentioned, but it can't be mentioned often enough, that smoking prevalence in e-cigarette hostile Australia has been flat in the 2013-2016 period. It went from 15.8% to 15.2%, but not a statistically significant difference according to Australian Institute of Health and Welfare. And this is despite extremely vigorous tobacco control policies. We're said to have the most expensive cigarettes in the world, and they're going up, the tax is going up 12.5% a year for the last 3 years, and every year for the next 3 years. And despite that and plain packaging and all the other things that we do, smoking rates are flat in Australia, but in e-cigarette friendly US and UK, as Colin's pointed out, they're falling like a stone. So we really need to think about this seriously. Let's examine the question of whether e-cigarettes really are harm reduction. Legitimate question. Well, what do you mean by harm reduction? Here's a definition, and confession time. I helped to put this definition together with the then International Harm Reduction Association, now called Harm Reduction International, and we've published this, and the website is on the board for you. And this is a contracted version of the full definition, but it says policies which aim primarily to reduce the adverse consequences of psychoactive drugs without necessarily reducing drug consumption. So that's what we thought, that's what I still think, is the essence of harm reduction. Now, a very important observation was made remarkably late, when you think about it, by Dr. Michael Russell, a psychiatrist working in England, in about the 1970s or 80s. He said, people smoke for the nicotine, but die from the tar. So why not let them have as much nicotine as they want to take without the tar that is responsible for virtually all of the deaths. So that's what e-cigarettes do. They provide the nicotine without the products of combustion, the products of combusting, of burning tobacco leaf. So Colin's already covered this, so I won't go over this. E-cigarettes enable smokers who are unwilling to quit to reduce the harm. And there are good reasons for thinking that they are successful in reducing that harm. As Colin's mentioned, the concentration of toxic substances in vapour is a fraction of the concentration that it is in cigarette smoke. Chronic conditions that we associate with smoking, the ones that have been researched so far, often improve after switching to vaping. Good evidence on that. Second-hand vapour has only got a fraction of the toxic substances which are present in cigarette smoke. And a lot is made of animal studies that have been done, but interpretation of animal studies is anything but straightforward, and a lot of the animal studies have been questioned because the assumptions on which the animal studies have been conducted, the settings of the machinery and the concentrations and so on, are often unrealistic. I think they're good grounds for believing that e-cigarettes do actually reduce harm. Now, when we're looking at harm reduction, we pointed out in that article that I mentioned, on that website that I mentioned, these principles of harm reduction. And you can see that e-cigarettes comply with every one of these criteria. They're targeted at the risks and harms. That means that the risk of the cigarette is the tar. We get away from the tar, so they comply with it in that way. They're based on reasonable evidence, not perfect evidence, evidence that is improving rapidly, and they are cost effective in the sense that the tobacco control is paid for by the taxpayer, but vaping is paid for by the vapor. Many smokers in Australia will spend $10,000 a year on smoking. Vapers will often spend $1,000 or even less a year. So for a predominantly low-income group of smokers, this saving of money should be of great interest to us. E-cigarettes are also incremental in the way they operate, in the sense that when we take someone who's heroin dependent, we persuade them to have methadone treatment, they're going from heroin to methadone, and we hope many of them will go from methadone to nothing. It's a series of incremental steps, and we know that the more you can break down complex behaviours into incremental small steps and get people to take many small steps rather than trying to get them to take one big step, we know that we are usually much more successful. It involves a degree of dignity and compassion. I regret to say, but I think it's true, that a lot of people in tobacco control are very hostile to smokers. We shouldn't be like that. We shouldn't be hostile to people who take heroin. We shouldn't be hostile to people who take alcohol. No problems. Shouldn't be hostile to anyone. And I think it's fair to say that people involved in policy wonks like me work very happily, Colin even more so, work very happily with vapers. And we recognise their dignity and compassion like anybody else. It's important principles of autonomy and universality and interdependence of rights. One of the principles of harm reduction is that when we see that the policy settings are wrong, we complain about them. We wouldn't have got around the world needle syringe programs unless harm reduction advocates complained about the lack of needle syringe programs. In most countries around the world, authorities eventually recognise the strength of the arguments. And here again, harm reduction advocacy involves, I think, advocating for making it easier for smokers to switch rather than, as it is in Australia at the moment, making it difficult. And it's important to be transparent and accountable and open up the whole process rather than have decisions about e-cigarettes made on the 25th floor of some skyscraper in New York or Geneva or somewhere that nobody gets to hear about, some sort of secret meeting. should be really, I would hope, open. So that's why I conclude that e-cigarettes really are quintessential harm reduction. The counter-argument that is made is that tobacco harm reduction's already been tried and it's failed. It's an interesting argument, but it's wrong. The argument is made in terms of filtered cigarettes, low tar, low nicotine cigarettes, and that's true that they were tried and it's true that they failed. But these developments emanated from big tobacco, from the tobacco industry, and we know from confidential tobacco industry records that later got leaked, and people worked their way through these and found that the tobacco industry knew that these developments, these initiatives, weren't going to work. So how can you call it harm reduction when cynical big tobacco was doing this ploy for public relations exercises, not for public health? So tobacco harm reduction hasn't been tried before with powerful tobacco harm reduction tools. The only tobacco harm reduction tool we've had up until now has been nicotine replacement, which is not attractive enough, not strong enough, doesn't, for whatever reason, work well enough. We've only had e-cigarettes since 2003. We had them, just a sec, we've had them before 2003, but they didn't take off commercially. I had the pleasure, as Colin did last year, of hearing Hon Lik, the Beijing pharmacist who developed e-cigarettes. As a young man, he's shunted off to the countryside in China against his wishes, forced to work in farming, and all the farmers are heavy smokers against his wishes. He becomes a heavy smoker, wishes he hadn't, tries to stop, unable to stop, gets posted back eventually to Beijing, studies pharmacy, and uses all his knowledge and skills to build a little machine that delivers nicotine to him without the tar. Extraordinary story. And that was the first e-cigarette that became commercially successful. Just let me get Stephen's point. And if you speak up.
Just picking up on the argument that the tobacco industry was behind the filters, low tar, low nicotine cigarettes. One of the arguments against vaping is that the tobacco industry appears to be getting behind it and promoting it. How do you address that issue?
It's simply not true. That's how I get behind it. I dispute what Nico said. I've got a lot of time for Nico. Don't agree with him on this. The vaping industry developed around the world largely because of ex-smokers who were so impressed by what vaping had done for their life, and many of them are really incredibly enthusiastic about it. And many of them ended up starting small companies, and the small companies were much more successful than the big behemoths, because the small, as Nico's explained, this is a complicated industry. It's dynamic and volatile, and whatever's being sold this month will be, wasn't sold a month ago, and in another month or two will be obsolete. And small companies are better able to follow the fads and fashions than the big companies, which are slow moving and can't do it. But even that is changing now, and you're right that big tobacco is now getting behind a range of products, much more than is on the table here. And this one, IQOS, is the first product of that Philip Morris International has produced, and that's the largest traded tobacco company in the world, based in Lausanne, and the biggest non-traded tobacco company, of course, is Chinese, but the biggest traded one is these guys, with a market capitalization of $110 billion. So a seriously big company. And they've spent $3 billion in research on what they call reduced risk products. And there's a whole range of these things that are going to come out. This whole pipeline heading towards us. So if you think it's complicated now, it's going to get much more complicated. They estimate that, of course, they can see the writing on the wall with their industry, and they can also see that that their profits are slowly declining, selling cigarettes, and these are much more profitable. And I recommend you look up the website of Philip Morris International. Look up, it came out in January, it's called Towards a Tobacco-Free Future. Since they put that website up in January and changed their direction, their share price this year has gone up 20%. Now, good thing, bad thing? I think it's a terrific thing. This week, the world lost Salvatore Riina, the head of Cosa Nostra in Sicily, and last night, Charles Manson died. Those guys have got nothing on these tobacco company assholes. And if these tobacco company guys now want to sell a product that doesn't kill 2/3 of its customers and wants to make even more money, well, I wouldn't mind if they were waterboarded, but if they can now make this stuff and make a lot of money and not kill people, well, we've got a common interest. Isn't that a good thing? Surely it's a good thing.
That's 6 or 7 minutes?
Yep. Okay. So, how do e-cigarettes compare with other harm reduction interventions, like the needle syringe program, methadone treatment, medically supervised injecting centres, heroin-assisted treatment, thiamine fortification flour to reduce the Wernicke-Korsakoff syndrome, huge success in Australia, which no one knows about. Condom promotion to reduce teenage pregnancies, sexually transmitted infections, car seat belts. What all of these interventions had in common was a hostile opposition, which was incredibly vigorous, lasted for many, many years, and ultimately these were accepted, and ultimately these were incredibly successful, far more effective than we thought they would be. But in each case, we were told the sky was going to fall in. We were even told the sky was going to fall in with car seat belts. My own professor of physiology, dean of medicine, Pansy Wright, said more people are going to die because they're going to drive faster and more recklessly. It's true that we might only find out e-cigarettes are harmful some decades later. Well, they're not going to be very harmful. They may have some harms. But I think we had an Ebola epidemic recently. People quickly developed an Ebola vaccine. Should we wait 30 years for the Ebola vaccine safety trials before we start using it, or should we use it now? And I think there are good reasons, likewise, to use e-cigarettes now. So in the interest of time, I'll move on quickly. I think Colin's covered a lot of this, but just quickly, the other concerns that are made are that it's going to be a gateway for non-smoking youth to start smoking. It's impossible to look at the survey results that are actually being done all around the world. The work you quoted, Nico, from Poland seems to be an exception, but there's survey after survey after survey showing that non-smoking vapors are very rare. 1 in 1,000 in Europe is the kind of figure that's quoted, and similar figures in the United States. In the United States, many of the young people who vape, but they don't vape with nicotine. They vape the flavors. How could smoking prevalence be dropping like a stone in e-cigarette friendly UK and US if it's a gateway? If e-cigarettes are renormalizing smoking, how could the prevalence of smoking be falling so rapidly? People talk about the e-cigarette battery explosions. They're rare, and as Collins mentioned, fires from cigarettes are much more common. I want to put to you something that I think causes a lot of unnecessary confusion in this debate. This e-cigarette debate is not about getting even with evil big tobacco. What it's about is reducing tobacco-related deaths, disease, and economic costs. Deaths, disease, economic costs. And if we can do that with e-cigarettes, so much the better. This is a study that was done by Levy, a modelling exercise in the United States, looking at what the potential benefits of e-cigarettes might be, and he did optimistic scenario and a pessimistic scenario, and you see the optimistic scenario over a 10-year period was 6.6 million fewer premature deaths. Pessimistic scenario, there were only 1.6 million fewer premature deaths. These are still sizable numbers, and I bet when we do the sums in the fullness of time, it'll be closer to the optimistic than the pessimistic scenario. So some conclusions, and then 3 questions, and then I'm done. E-cigarettes, I put to you, are valid. They've got an important role in tobacco harm reduction, and tobacco harm reduction is mentioned in the Framework Convention on Tobacco Control. It's mentioned in Australia's tobacco control policies, and it's mentioned also in our national drug strategy. So if it's there, what's stopping us using it? The experience we've had follows exactly the same trajectory, same pathway that other new harm reduction interventions have unfortunately had. It's a consumer device, it's not a clinical intervention. Nicotine for e-cigarettes are listed in our poison standard. Nicotine in cigarettes are excluded from our poison standard. How can we possibly justify that? There are substantial net public health benefits, and as the UK Royal College of General Practitioners said, where a patient wants to quit smoking and has not succeeded with other options, GPs should recommend and support the use of ENDS, electronic nicotine dispensing systems. So 3 questions. What would you do if someone you really cared about had tried many times to quit without success and asked you, should they try e-cigarettes? Would you say, no, don't try e-cigarettes? I mean, come on. All of us would say, well, you've tried 40 times, Bill, you may as well try e-cigarettes. All of us would say it. And if we say that to someone we care about, why wouldn't we say the same question, same answer rather, to people who other people really care about? Finally, I want to put to you that restricting e-cigarettes really, essentially, when you boil it down, protects cigarettes, and that's not something we should be doing. Thank you.